Good afternoon, everyone. Thank you for joining us today. So I want to start off with just a few comments. Our hearts and minds are with our staff member who was injured in the assault yesterday. She is out of surgery. She's in critical and stable condition. We're really pleased to hear that, and we're really wishing the best for her as we continue moving forward. The hospital is safe and secure. We have reopened the hospital to visitation. That occurred at 2 o'clock today. The staff are doing okay. I've been here now for the last number of days, and I can tell you they're shocked. They're really worried about their coworker. They're dealing with the stress of it. But you know, one of the things that I've just been so impressed with and humbled with is the compassion that our staff continue to show in light of a situation that is so traumatic for them. They're used to seeing people come in injured and hurt. They're not used to seeing their coworker beside them. And so that has been a very traumatic event. Certainly our managers are supporting our staff. We have spiritual care on site, and we have the assistance program also located on site. One of the things that I really want to get out to the community, and I think it's very, very important for me to say, you know, this pandemic has been a very, very difficult time for everyone. And we've all struggled through the pandemic. We're frustrated by the pandemic and restrictions that we've all had to face and to deal with. But our healthcare workers, they have to deal with those same frustrations in their personal lives. And then when they come to work, they have to put on a brave face and support all of the people who are coming forward. And something has happened in the last couple of years that we've gone from a situation where people have been out on their yards banging their pots and pans and saying, we support you, we're really appreciative of you, to a situation now where more and more healthcare workers are facing abuse and frustration. And what our healthcare workers need is compassion, patience, and kindness. And that is my plea on behalf of our team. They are here. They're here to serve. They will continue to serve. Thank you. I'll take any questions that you might have.
The suspect, the police said to ask you about the employee relationship regarding the suspect. What can you tell us?
So the individual who assaulted our staff member was an employee of Seven Oaks Hospital.
What was their employment status?
They were employed, but they were off. They weren't actually on site working when the assault occurred.
You had shifts, presumably in recent days and weeks.
They had shifts and those, but they were not on shift when this occurred.
You mentioned tensions rising about the COVID-19 pandemic. I take it that's related to the attack yesterday, and that's why you brought it up?
No, that's I brought it up because I think this is one of the things that we're starting to see and experience. And people are frustrated, and they're taking it out on healthcare workers. And so it's not that it was related to that incident. I just wanted to bring that forward because that is something that we are seeing more and more, and we just need the community to be patient with our care workers because they're working under very difficult circumstances.
Was it an attack on a supervisor, or?
I can't comment on the relationship. What I can tell you is the individual who was assaulted was not the direct manager of the person.
Did they work on the same unit?
I can't comment on that.
Can you say if this was a healthcare worker directly or frontline worker, or if this was custodial staff, was this some other type of role?
I can't comment on that. I can tell you that they were an employee, but if I start getting into details, then you could potentially identify the person, so I can't speak to that.
Sure, I missed the answer to the last question. The status of employment was he was on paid leave or something like that?
No, as far as I know, he's an employee. He did not have any shifts when the incident occurred.
So does that mean an unpaid leave?
No. He was an employee of the organization.
He could have been. He was on schedule to come to work another day.
As far as I know.
Okay.
Yeah.
I know it's early, but at this point, are you thinking there's anything that could have been done to prevent the situation?
No, this was really just an unprecedented situation. Literally what happened is the individual came in, passed our screeners and proceeded to assault this individual. It was not, it was it was not anything that anybody could have anticipated.
Was the hospital alerted at all about the individual being in the area or being in the city?
No, there were no alerts that had come to us that there was any concern or issue towards safety of our hospital or staff.
How long did the situation in the hospital last? The assault itself, do you know?
I don't know the details, but I understand it was minutes.
How did hospital staff contribute to subduing?
We had a number of staff that jumped the individual, managed to take them off of the individual that was being assaulted, and then hospital staff reacted immediately to care for their co-worker, and it was an amazing response. They rushed her to the urgent care, and then they were rushed off to receive surgery.
Which did you go to HSC from here?
I can't comment which hospital she's in.
Can you confirm that the incident was accidentally broadcast over the intercom through the hospital?
The incident wasn't broadcast. What had happened was, as the incident was occurring, one of the staff members called what's called a code blue, which is to say that there's an injured individual. And so some people throughout the hospital were able to hear what was going on at that time. Yes.
What time was the code blue at? Around 2:30 then?
It was about 2:30.
Okay.
Mike, sorry, can you just remind the folks about the hospital resuming visitation and operations?
Yeah, so the hospital is fully functional. Visitation has been resumed as of 2 o'clock. So we have families, they're welcome. It's patients having families there. It's very important for their healing. And so we felt it was very important to resume that as quickly as possible. The teams are there. I can't express enough how resilient they have been with it. They are there and they're caring for their patients, and it's been extraordinary.
Do you have an idea of how many staff members were directly involved in that situation? Like when it came to jumping the person?
I don't know. It was right in the lobby, so you could imagine. There were a number of staff. There were patients, families who witnessed it, and so it was very traumatic. And as I've said, we have supports in place for not only our staff, but we've made supports available to those individuals who may have witnessed it but are not our staff.
Is this the employee? Is he undergoing any mental health treatments?
I can't comment on that. I don't know, and B, I wouldn't be able to comment on it.
Sorry, you said that you can't really elaborate on the relationship between the person that was attacked and the attacker, but when the attacker came in, did they ask for this person? Were they seeking them out, or was it a chance encounter? No,
this individual just walked right in, past the screeners, and assaulted this individual. We have no idea why.
Is that concerning to you that a person could just walk right in, and attack someone? Like, what kind of, preventative measures or security would be in place for that to get a weapon?
So this wasn't a security issue. This was an individual who came in, premeditated, was not waving a knife around or yelling or screaming. It was hidden, went in and assaulted someone. So it really couldn't have been prevented, I don't believe. But we have reviewed our security. We've added additional security, really for the security of our staff, but also to deal with some of the issues of redirecting patients that we've had to do over the last couple of days because the entrances were being closed off while we were dealing with the investigation of police.
Do you know what the victim was doing at the time they were assaulted? Were they in the front atrium doing a particular task, or what their role was?
No, they were down in the atrium having a chat with one of their colleagues, and they were wrong place, wrong time.
Can you give us kind of an idea of a little bit more about the victim in this case, like long-time employee, that type of thing?
I really can't comment a lot. This individual is a long-time employee, well loved by staff and her colleagues, we're just really, really happy that she's out of surgery, and that at this point in time we understand she's stable, and we're monitoring that situation as carefully as we can. Obviously we're not trying to impose too much because the family and this is a personal health information type situation, so very challenging, but we're hopeful that she's going to recover. And I was with the team, and they said we're going to have one hell of a party when she returns, and we're looking forward to that.
Apologies if this has already been asked, but what kind of supports are available for staff members who might be experiencing some trauma after this?
So we have had last night a critical incident stress management team that has been on site. We've had spiritual care that's been on site. They were on site last night till 9 o'clock. I was on site with the executive team till well past 10 o'clock last night. We were rounding, talking to staff. That team has been on site since 6 o'clock this morning, and they are up on the units talking with staff, supporting staff. We've also made them available to staff on their own personal time. So the supports are all in place. We are really focused on the care and well-being of our staff, because this is not an incident that I think anybody expects to have in their career. I don't know that I have the misfortune of having this in my first 6 months on the job, but I'm just so proud of the team and the entire healthcare community, because it's happened at Seven Oaks, but everyone is rallying to support the Seven Oaks family. So we have reached out to all of our sites, and we have said if you need to do a risk assessment, do so. If you need additional security, we'll add additional security.
Are the security measures going to remain in place for the time being, or for the unforeseen future?
They'll remain in place as long as we feel they're necessary.
One or two more folks here, and then
just to talk again, like, this is a traumatic experience for people who knew the woman involved, but it's also one of their own is being accused in this. How are staff responding to that aspect of having someone on their own team being responsible for this?
Well, I think that just compounds the issue, because it's we have the worry and the concern for our staff member, and then we have the worry and concern for the individual that did this. And I will tell you, I'm really impressed with the leadership team. Like last night, the leadership team here, the chief operating officer, the chief nursing officer, myself, we cleaned up after the assault, because we did not want our environmental services staff to have to deal with this. So they donned they wouldn't let me don it because I'm not a clinician, but they donned all of it, and they cleaned the blood off of the floor, and then we asked the environmental services staff to come in. So everybody's coming together. They're supporting one another, and I'm just very appreciative of that.
Off the top, you mentioned the impacts of COVID-19 and how the staff are seeing more and more disgruntled people coming into hospital healthcare facilities. What kind of complaints or issues are you seeing raised from your staff? Are you hearing a lot from them, or is it just more you're just seeing more and more of it?
We're hearing a lot of anecdotal situations where individuals are coming in, refusing to be screened, so pushing past the screeners, doing those types of things. That's completely unacceptable. We're absolutely looking at how we can ensure that our staff are not having to deal with the abuse. Our staff are here to care for individuals, and all we expect in return is respect and civility, and that's what we're looking for from anyone who's coming to our facilities for care.
And how are they handling the staff mental strain that they're under, or the stress that they're under? How are they handling these types of outbreaks, these types of episodes? Are they cracking? How are they handling it?
Listen, healthcare professionals, none of them are cracking. They are resilient. They are stepping up to it, and I can tell you that they're stressed and they're tired and they're exhausted, but they are there and they are caring for our patients. Thank you, everyone.
Yeah, and
thanks, guys.
You said she was in stable condition.
She's in stable condition. Yeah.
Thank you.
Thank you so much.